Did you know pancreatic cancer claims more lives each year than breast cancer, yet barely gets talked about? By the end of this video, you'll know 8 overlooked warning signs that could help catch this deadly cancer early. Pancreatic cancer is one of medicine's most challenging adversaries, with a 5-year survival rate of just 11%. This silent disease affects over 60,000 Americans annually, and studies show that 75% of patients don't recognize their symptoms until the cancer is already advanced. Here's what's truly shocking. Many of these symptoms appear months before diagnosis, hiding in plain sight. Your pancreas, an organ about the size of your hand, works quietly behind the scenes, producing vital hormones and enzymes. Its deep location in the abdomen makes it hard to examine, which is why recognizing early warning signs is absolutely essential. Today, we're breaking down 8 surprising symptoms that could point to pancreatic cancer. Some of them are so common you might already be experiencing them without realizing their significance. And here's something even more surprising. New research from Johns Hopkins shows that when just 3 of these symptoms appear together, the chances of early detection rise by 68%. So why isn't this talked about more? If you find this video helpful, be sure to hit that like button and subscribe for more health insights. Now let's dive into symptom number 1, dark yellow or brown urine. Your urine can reveal a lot about what's happening inside your body. In cases of pancreatic cancer, the bile duct often becomes obstructed, leading to jaundice. This happens when bilirubin, a yellowish substance created when red blood cells break down, starts to accumulate in the body. Normally, the liver processes bilirubin and eliminates it through the stool, which gives stool its brown color.
Oh yeah.
But when pancreatic cancer blocks that path, the system gets disrupted. As a result, even if you're drinking enough water, your urine may turn dark yellow or brown, similar to cola or strong tea. That's your body's way of flushing out excess bilirubin. Many people brush off this symptom, thinking it's just dehydration or dietary changes. But if that dark color sticks around for more than a few days, even when you're well hydrated, it's a sign that shouldn't be ignored. This kind of discoloration can show up even before more visible signs of jaundice, like yellowing of the skin or eyes. Recognizing this subtle cue could make all the difference in catching the disease early. Upper abdominal or back pain. The location of pain caused by pancreatic cancer can actually offer important clues. When tumors form in the body or tail of the pancreas, people often report a specific type of discomfort that's hard to miss. It usually begins as a dull, ongoing ache deep in the upper abdomen. What sets it apart is that it frequently radiates to the back, creating a band-like pressure across the torso. Unlike typical stomach pain, this kind tends to worsen after eating or while lying down. That's because the pancreas is surrounded by nerves and organs, and when a tumor presses on them, it triggers persistent pain. Some people describe it as a gnawing sensation, others say it feels like constant, heavy pressure. This pattern of pain can come and go at first, offering short periods of relief. But as the cancer progresses, the discomfort typically becomes more consistent and intense. Tracking how your pain changes over time can help doctors distinguish pancreatic cancer from other conditions. The timing, location, and type of pain all offer valuable diagnostic clues. Gas or bloating. Pancreatic cancer can quietly disrupt your digestion in unexpected ways. Tumors can interfere with the pancreas's normal function, causing unusual bloating or a sense of early fullness. Your pancreas helps break down food by producing key enzymes. When this process gets interrupted, you may feel overly full after eating only a small amount. This is known as early satiety, and it may be due to the tumor pressing against your stomach or small intestine. The bloating associated with pancreatic cancer often feels different from everyday gas or indigestion. It lingers, doesn't respond well to antacids or dietary tweaks, and may leave your abdomen feeling tight and swollen, even if you haven't eaten much. This kind of discomfort often gets worse after meals, but can persist throughout the day. It's not just inconvenient, it's a signal from your body that something deeper may be wrong. Many people chalk it up to stress or poor diet. But if the symptoms last for several weeks, it's time to speak with a healthcare provider. Swelling of the gallbladder or liver. As pancreatic cancer develops, it can trigger changes in nearby organs, especially the gallbladder and liver. This happens when tumors block the bile duct, a crucial pathway that moves bile from the liver to the intestines. Under normal conditions, the gallbladder is about the size of a small pear. When bile can't drain properly, it builds up, causing the gallbladder to swell. The liver may also enlarge due to the same bile backup. This swelling can sometimes be detected during a physical exam, showing up as a firm enlargement under the right rib cage. Imaging tools like CT scans and ultrasounds can also spot these changes clearly. These organs are tightly connected. When one is affected, the others often follow. Understanding how they interact helps doctors piece together the bigger picture of what's going on. That's why changes in these organs are often evaluated during routine exams. They can be early indicators of hidden pancreatic issues. Blood clots. Another lesser-known sign of pancreatic cancer is an increased tendency to develop blood clots. This cancer can create a hypercoagulable state, meaning your blood clots more easily than it should. A condition called deep vein thrombosis, or DVT, often develops in the legs. It may show up as swelling, warmth, and redness. The danger arises if part of the clot breaks off and travels to the lungs, causing a potentially deadly pulmonary embolism. This clotting happens because pancreatic tumors release inflammatory substances into the bloodstream. These disrupt normal clotting mechanisms, making it easier for clots to form. Symptoms of a pulmonary embolism include sudden difficulty breathing, chest pain that worsens with deep breaths, and a rapid heartbeat. These are medical emergencies and require immediate attention. Fever and chills. Fevers in pancreatic cancer often reflect the body's response to internal inflammation. When the pancreas becomes inflamed, the immune system reacts, setting off waves of temperature changes. These fevers can be tricky. They tend to come and go. You might feel cold and shivery one moment, then spike a high fever the next. Unlike fevers from common infections, this pattern is more erratic. The combination of jaundice and inflammation creates ideal conditions for these temperature swings. Your body is under pressure, fighting blockages, inflammation, and cancer all at once. These fevers are often accompanied by night sweats and a general feeling of malaise. Unlike a viral fever that fades in a few days, these tend to linger or recur over time. Fatigue or physical weakness. Pancreatic cancer can sap your energy in profound ways. This isn't everyday tiredness, it's a deep, persistent fatigue that rest doesn't improve. Cancer cells consume nutrients meant for healthy cells, leaving your body depleted. Even simple tasks, like walking or doing chores, can suddenly feel overwhelming. This fatigue is often accompanied by emotional symptoms like anxiety or depression. Sleep patterns may also be disrupted, feeding into the cycle of exhaustion. What makes cancer-related fatigue distinct is its unpredictability and persistence. You may wake up feeling just as exhausted as when you went to bed. It creeps in slowly, making it easy to misattribute to aging or lifestyle. Digestive problems. Pancreatic cancer can throw your digestive system out of balance in multiple ways. The pancreas plays a crucial role in breaking down fats, proteins, and carbs. When enzyme production is disrupted, it can trigger a cascade of issues. Undigested food may sit in the stomach, causing nausea, vomiting, and discomfort. Appetite often decreases, leading to weight loss and nutrient deficiencies. One clear sign of disrupted digestion is a change in stool. You might notice stools that are pale, greasy, and particularly foul-smelling. This happens because fat isn't being properly broken down and absorbed. Recognizing these 8 warning signs of pancreatic cancer could make a critical difference in detecting the disease early. If this video helped you, hit that like button and subscribe for more health insights.